So I want to introduce Dr. Blatz. He's giving me a follow-up today. I had the procedure 12 days ago, and so there we are.
Yes, welcome back.
Thank you.
Tell me how things are going.
Really, really well. I started using the crutches right away.
Nice.
And slowly but surely, it says wean off the crutches. And I noticed, well, I can't do yoga with crutches, so why don't I just not do that?
Sure.
And basically that's what I've been doing. And yesterday I thought, man, my knee is sore. Maybe I should use the crutches again. And I did that for an hour, and I was like, I'm so sick of these. And I could do it without.
Great.
So,
That's super.
Yeah.
I mean, I usually provide crutches as a comfort thing, right? And a lot of what we do in the knee, it's not like I have to have anything repair or heal, right? I haven't put sutures into anything.
Yeah.
And really the knees and other joints, especially weight-bearing joints, they like movement and they need to have some pressure to be able to, start that healing process. So I'm actually okay with people getting off crutches whenever they feel comfortable to do it.
Yeah, good.
That's good. Yeah. And it doesn't seem like you need it.
No.
You were walking well today.
Yeah.
That's awesome.
Yeah.
Any increased swelling or anything that you've noticed?
Well, not increased, but
Okay.
Swelling from the procedure.
About the same.
And every
Okay.
day it gets better and better.
Yeah, that's good. That's good. And how was the back where we did the harvest?
Nothing.
Really?
Yeah, that was the
That's
one I was
amazing.
afraid of. Everybody
That's
talked
amazing.
about, oh
Yeah.
God, you're not going to be able to sit down.
Yeah.
Yeah, I mean, it's like a scratch.
Yeah.
It's like a significant scratch. Like
Okay.
today when I did yoga, I had blocks underneath there.
Yeah.
And yeah, I felt them.
Yeah.
But
Yeah.
no, nothing. This is the
Yeah.
biggest deal.
That's the biggest deal.
And then my right big toe,
Mhm.
I'm so excited because I can tell
Already.
it's gonna take care of itself.
That's amazing.
Yeah.
That's amazing.
And that's really been a hassle for the last year and a half.
Yeah.
So whenever I would do any kind of yoga things with my big toe,
Mhm.
yeah.
And
No.
those can be really stubborn.
Really?
Some of the most stubborn joints that we deal with are
Uh-huh.
the smaller finger joints and the smaller toe joints.
Uh-huh.
And so being able to have this as an option, because before it was just like cortisone or surgery, and even surgery for these types of things, not a great option.
Right.
So being able to have this, it can be very helpful.
Yeah.
So I'm happy
it's
about
good.
that.
So well, when I had it, I had it X-rayed,
Yeah.
and there was an avulsion fracture, and the doctor said, "There's not a lot we do for that."
Yeah. Right. And you're like
Time. We just do time.
Right.
Well, how long?
Yeah.
It's been a year and a half.
Right. Right. And it's still bothering me.
Right. Exactly.
Right.
So that's exciting. I mean, that's a little side note.
Yeah. That's
and,
great.
And great.
That's awesome. And it sounds like you're doing pretty well with the brace.
Yes.
Kind of figuring that out.
Yeah.
Right? And again, for you, because we did your kneecap, your patella,
Oh, right.
there's not great bracing options for that.
Uh-huh.
But really what this is intended to do is open up that inside joint space
Mhm.
because we hit your meniscus and your MCL, right? And so the idea is if we hit that ligament that was kind of floppy before, and we
Uh-huh.
get that to heal and we get that to tighten up, will that start to restabilize your knee and improve it overall? And so being able to have that where it opens up that space, we really want to train the body to heal in that position, basically.
Uh-huh. Oh, that's really good.
That's the idea.
I was wondering, I was just looking back over my MRI, and I noticed that there really wasn't too much about the structures that you hit in the back.
Mm-hmm.
And I was so impressed by you
Yeah.
that you said, well, I re-looked at your MRI, and this is what I saw.
Yes.
So you didn't just go by the report. You went by what you saw.
Correct.
Yeah.
And what's amazing about it is very often overlooked. And I give some credit to my colleague here, Dr. Desai, who he's a trained musculoskeletal radiologist, but even the musculoskeletal radiologist, that's something that they just don't discuss. But when you start to have to think about individualized patients that you're seeing and people that you have to try and stabilize a knee to the best ability you can, you start to look at MRIs and other imaging differently.
Yeah.
You start saying, like, what is the body trying to tell me, right? And I always say, like, the MRI is telling a story. So any place that says that there's damage, it's usually a consistent constellation of problems related to something like arthritis. And so it's like, okay, well, if we have that opportunity to hit those spots and we can do it in a safe way, we should try and heal those tissues.
Yeah, and the other thing was, oh my God, that Baker cyst that I have in the back of my knee, I had in the back of my knee,
Yeah.
has been there for years.
Right.
And you know, as a chiropractor, I have to confess, I didn't understand that means you've got something going on.
Right.
You don't just let that be there.
Right.
Because I always felt like, well, it doesn't hurt me.
Right.
So
Then
I don't care, it's
right.
no problem.
Right.
And also I like to be tough.
Yes. Right. Exactly.
But yeah,
Yeah.
it's like it was getting bigger and bigger and bigger.
Yeah. And I think like once this overall swelling of the procedure goes down, you're really going to notice a difference of that, particularly in like your range of motion and your movement patterns. Particularly when you're doing your Tai Chi and your yoga, you'll be like, wow, I can really notice a difference. So.
Can you speak to how it is significant with a Baker cyst? What does that imply?
Yeah. So as you just stated, almost inevitably a Baker cyst is going to indicate that there's some internal derangement inside the knee joint, and that can be any number of things, right? But in general, it's a kind of creation of fluid inside that joint, and basically the Baker cyst is a path of least resistance, right? And so it kind of finds its pathway back to there, and then it's just an easy space for it to fill into. Sometimes it'll be a one-way valve, meaning that the fluid will get in there, but then it's not capable of coming back in. So it'll just pocket itself for years and years into that spot, which is, I think, similar to what happened with you, right? Yeah. For some people, it's a two-way valve, and so they'll actually notice it more, because whenever their knee flares up, that fluid will just flood into that area, and they'll get this sense of like, wow, it's so stiff in the back of my knee. And then you can imagine thinking about those tissues that we talked about in that posterior aspect. Well, anytime you have that fluid, those are going to get pushed out more, and then that's going to pull on their connection to the bone, and that's most likely why you get kind of extended damage from that, right?
Yeah.
So where you might not notice pain per se related to those posterior structures, you're going to have instability and kind of a range of motion abnormality to a lot of the things that you do, right? And so I've also seen before too where the people will complain of calf pain or hamstring pain, and maybe not even necessarily posterior knee pain, but they complain of those two things. Well, that's where those two cross, right? Your calf muscle and the hamstring muscle cross in that area. Now if you put a big old balloon that kind of pushes those backward, now you can imagine that their muscles are going to react. Yeah. So the more that we can kind of get those to relax and start to stabilize in the back, the more improvement you're going to get.
Yeah. And then how about with the meniscus? So my meniscus wasn't torn per se. It was frayed.
Yes.
Could you speak a little bit to that?
Yeah. So again, you have some joint space narrowing in your medial compartment or the inside compartment of your knee. And that meniscus is there to create cushioning, but also nutrition to that joint space. Okay. Now, when you get collapse of that joint line, it will squeeze on that meniscus. So that can be enough of a squeeze for some people that if they make some movement, it will actually tear right through that meniscus. Yeah. But others, it'll just give enough squeeze that it starts to degenerate or kind of fray like you talked about. Yeah. And so you get little micro movements through that bone, and that'll start to grind down that meniscus. And so obviously it's not providing the best cushioning anymore, but you also lose the nutrition aspect inside that part of the joint line. So the more, like we talked about with the brace, that's a mechanical aspect of trying to open that space up and give that meniscus a little bit more room. But then I did a biological aspect of injecting into that meniscus that's already, a little busted up. Let's see if we can start to improve that, to improve not only its cushioning, but then improve the nutrition in the joint space too.
Yeah, and I actually had, I did have a tear, a medial tear, about 20 years ago that we've talked about. And I did have a surgical correction, which worked great for a long, long time. However, it's my understanding that really there isn't a surgical option on a frayed one. Because what do you sew up? Yeah. Nothing, right?
You just cut it out.
You cut it out, and then you've got nothing.
Yes, and I think that is to the detriment of a lot of patients, and I hear it all the time. They come in and they say, I had a meniscus surgery. And I said, specify. Was it a meniscectomy or did you get a meniscus repair? Yeah. And most of the time they go, I don't know the difference between that. Yeah. And I say, well, unfortunately, there's a huge difference. Because any amount of cushioning that you're cutting out of there is now putting at risk of that just collapsing even more. Yeah. So it's actually a rare patient that has the the type of meniscus tear that can be repaired,
Uh-huh.
right? And so I encourage that whenever I see somebody that's a surgical candidate to speak to their surgeon and say,
Uh-huh.
is this repairable? If it's not,
Yeah.
how much do you think is actually going to be taken out?
Yeah.
And I think that's where Ortho Biologics comes into this, because
Uh-huh.
there's actually been studies that were done that did a sham procedure for a subset of patients, randomized controlled trial. Then the other set got a meniscectomy.
Yeah.
Everybody had a quote unquote torn meniscus that went into this study, and there was no difference between the groups,
Wow.
showing that there's probably little to do with sort of these degenerative tears of the meniscus. It's more to do about the overall disease process of the arthritis, right? And so that's where Ortho Biologics can be very beneficial. So I'm not necessarily after kind of clearing pain per se related to a meniscus.
Yeah.
I'm there to try and improve its health for the overall benefit of that joint.
Gee, concept.
Right? Right?
That sounds like a really good idea.
Yeah, yeah.
Well, when you say orthobiologics,
Hmm.
so basically when you say that, you mean regenerative medicine?
Correct.
Yeah. And then could you define that?
Yeah. So the way I think about orthobiologics, specifically kind of where we're at now in terms of the regulations for the FDA,
Uh-huh.
I'm most specifically talking about autologous tissue, essentially meaning tissue from your own body.
Yeah.
And so, as you know, we took your own blood,
Yeah.
we took your own bone marrow, and we
Uh-huh.
took your own fat product, right? And so that we utilize for multiple situations with it that are basically all part of your healing process in your body. And so the ortho portion of orthobiologics, essentially meaning the musculoskeletal system,
Yeah.
right? And that's what I do.
Yeah.
And then biologics being what kind of biological process and substances can we use for the healing of those musculoskeletal issues. I look at regenerative medicine as a bigger umbrella that encompasses orthobiologics. And so there's a lot of people doing great work on, say, stem cell treatments for, say, people that have type 1 diabetes. And they're trying to improve the beta cells that are not working properly to be able to get those people to produce insulin in a correct way, right?
Yeah.
And so that encompasses that regenerative medicine,
Okay.
but orthobiologics, I would say, is under that.
Yeah. And in fact, when I went onto your website, which I encourage people to do, because there's a wonderful, well, there's actually 2 places where you're listed.
Yeah.
I thought the one about the new guy
Uh-huh.
was really good because it just kind of went over quite a number of issues
Yes.
about you.
Yeah.